This is the second video related to the signature assignment. It includes the parts of the assignment related to specific types of interventions that you might want to select if you were a therapist, a licensed social worker, or a licensed professional counselor, or even perhaps a licensed marital family therapist, whatever qualifies you to provide these sorts of interventions. You have, for possible interventions, the use of psychotropic medication would include, in many cases, medications like SSRIs or selective serotonin reuptake inhibitors. Examples of that type of medication would include Zoloft, and we'll leave it at that. There could be other types of SSRIs that a person might use or to diagnose or to provide help in those particular circumstances, but please note very carefully that in most states of the United States, it is necessary to be a medical doctor with special training in psychiatry to be able to offer prescriptions related to medication. In the state of Texas, licensed psychologists cannot provide written script or any other type of script related to the provision of psychotropic medication. So in a case where I function and where I practice here in Texas as a psychologist, I have to refer my clients to psychiatrists in order to provide them access to medication. So that being said, psychotropic medication is always a potential intervention that you can use related to depression, bipolar concerns, even in some cases antisocial personality disorder, certainly erectile dysfunction, as in the case with Mr. Soprano. So one of the possibilities to offer as an intervention would be psychotropic medication. Cognitive behavioral therapy is also listed second on your list of possible interventions to provide for Mr. Soprano. Cognitive behavioral therapy interventions are not only what's in vogue, but they are interventions that have scientifically proven data that back up their use as it relates to specific disabilities and specific psychological concerns like major depressive disorder or bipolar 1 or even bipolar 2 in some cases. Just bear in mind that when you are selecting two of the potential not diagnosis, but two of the potential interventions, be sure to remember in what cases some of them, if not all of them, might or might not be used. And this video, certainly in no way, is going to provide you with all of the reasoning related to what types of interventions to use. Again, the assignment is more cumulative in that regard. We will get to pieces of information related to other types of interventions as we go. But as an example, if you wanted to offer therapeutic intervention, you could use CBT. It would be very advantageous. You could also use solution-focused therapy. You could use psychodynamically characterized therapies, which would include things like existential concerns. Gestalt therapy in some cases might be very effective depending on the disorder that a person is dealing with, things of that nature. Electroconvulsive shock therapy is listed third as one of your possibilities, but please make a note. Listen very, very carefully. It is only in very rare circumstances, at least in this particular time frame in life in 2023, that individuals undergo electroconvulsive shock therapy. It is available. It has been available for some time. It has been improved over the years, but please note, it is only used in the direst of circumstances when no other interventions have been effective in any way. So please note that in Mr. Soprano's case, the potential use of electroconvulsive shock therapy is probably not going to be one of your most viable options. And again, as in the first case or the first video, you are to provide an explanation for why you decide to use whichever two interventions you decide to use. And one of the reasons you would exclude electroconvulsive shock therapy is the fact that not only is it rarely used, and even though it can be advantageous in some circumstances, it is used as an absolute last resort, and there is no information in the case study that would suggest that other interventions interventions have failed. So please bear in mind that ECT is probably not one of your best options here. And again, as the semester progresses, we'll have much more conversation related to diagnoses and their potential use, as well as other potential interventions that might be used in certain cases. But for now, just remember that psychotropic medications and cognitive behavioral therapy interventions are always going to be reasonably advantageous interventions, certainly in cases like are noted for this particular assignment. Watch next for the third video for the information related to providing the necessary answers for the computation parts of the exercise, which include a person's IQ and certain information related to a graph that you'll find there on your answer sheet. And we'll talk about those next.